Hey there. So this video, it's for second year med students who are trying to decide what clerkship order to request. Of course, you're not guaranteed the order maybe, but what you should request. And this is a screenshot. I have a screenshot of my grades, the clerkship order that I did. Hopefully this advice might help you to set up the right clerkship order that helps you succeed in fourth year and gives you a great third year experience. So I started off with, we all had this introduction to clerkships, which was just like a week of virtual policies and procedures and stuff. And I did adult medicine, which was internal medicine wards for 2 months. Started off at the community hospital and 1 month at the 1 month at the VA and then 1 month at the community hospital. I got passed with commendation. For us, our grade was rhyme scale and then your shelf. The rhyme scale: reporter, interpreter, manager, educator. I definitely got reporter, interpreter on my first rotation, and then I got a pass with commendation. We have pass with commendation, honors. As you can see in the screenshot, I got a pass with commendation. And then I did OB and then PEDS. In OB, I got manager. In PEDS, I got interpreter. And we had a combined grade, unfortunately. Some people think that's an advantage. Some people say it's a disadvantage. I got a PC, and I got primary care. I got PC. Got interpreter again. For me, primary care was a very terrible experience. I was unable to perform for sure. And then I did surgery, I got honors. And then I did psych and neuro, psych first, then neuro, and I got a PC. And we had this longitudinal, like doctoring, which was like physical exams and stuff. And I just passed. And then I had electives. The electives were between my surgery rotation and my psych rotation, and I got honors in both of them. One of them was MSK anatomy. The other one was ortho trauma. Okay, so what order should you do? You know, if you're going into a surgery specialty, let's talk about that first. So there's really like two things to consider, I think. There's exposure, and when you want to be exposed to the specialty that you want to be in, like surgery. And then there's prep. Do you want to go in there prepared? And do you want to prepare you for fourth year? If you do your surgery rotation in the beginning, then you have 7 months of non-surgical stuff. And then you go into fourth year. I mean, you're going to be rusty. That's just the truth. Okay? In my case, why did I do OB first and then surgery near the end? And then I picked the easy rotation, psych and neuro near the end because I wanted to prepare for step 2. So the reason was, when I do OB early, I'm going to get exposure to the operating room, gloving, gowning, draping, suturing, closing, getting used to blood and all that stuff. In the operating room, the tools. And then I'll have like a month or two to regroup from the OR and practice my suture skills at home and things like that. And then I did my surgery clerkship. In my case, it helped me. I obviously only got honors in one clerkship, which was surgery, so the way I set up worked. The other advantage it gave me is I took step 2, and then 3 months later, I was on my fourth year rotations in orthopedic surgery. So I had done, and I was just fresh from surgery as much as possible, I think. So I still knew how to suture, and I still knew how to drape and gown and all that, and it was seamless. I was comfortable. Okay, now, why did I do internal medicine first? Because I didn't value it. It was going to teach me everything about the hospital, how the hospital runs. It's going to teach me how to present a patient. It was going to teach me how to use the EMR and all that stuff. And I didn't want to be learning those ropes on my surgery clerkship. So I started off with something that I knew for sure I wasn't going to go into, even though I ended up soaping into internal medicine. So, I mean, guess what? But that's a whole nother discussion. So now, what's the disadvantage there? Well, I didn't get exposure to surgery early on. So, for example, maybe research projects in surgery, or my elective in ortho trauma, which I did after my surgery clerkship. If my surgery clerkship was earlier, my elective time would have been earlier too. That just was the case in my school, and I would have been exposed to ortho residents through clerkship sooner. Of course, you can always give up your weekend and your nights and your sleep, okay, and your time off to go to the OR. The OR is running 24/7. No one's asking you to go to sleep or to go home, okay? You're choosing. You're choosing to do that. No one's asking you to go eat or drink water, all right? You're choosing to do that, okay? So at the beginning of your clerkship, whether it was internal medicine or peds or whatever, you have the option to when you're dismissed at 6 p.m. or at 5 p.m., you have the option to go to the OR. You know, when you have a day off, you have the option to show up in the OR with your hospital badge and talk to the surgeons and say, hey, can I come in and operate with you? You know what I'm saying? But I wanted to do things, you know, I wanted some breaks in life. And I think I was, you know, I didn't match because of that, but this is what I'm talking is the clerkship order that gives you exposure through the clerkship curriculum, not any outside stuff, extra stuff, which you always have the option to do. Now, let's say that you want to do internal medicine, for example. Then it's like a no-brainer. Internal medicine should be at the end, okay? Because you're going to learn everything else about the hospital, and then your last rotation, you're warm, your feet are wet, you can hit the floor running. You're going to know a little bit about OB, a little bit about surgery. You're going to know the EMR. You're going to know how to access up to date and stuff. Your step two studying. You're going to be full blown into it. You're going to know all the PIM questions, and it's definitely going to help you with step two because step two is, you know, usually people take it at the end of third year, and step two is mostly medicine. So your internal medicine clerkship should be at the end. I think the specialty that you want to go into, it should always be near the end, okay? Because that's when you're going to be most prepared. Now here's the catch. The catch is there's kind of like a criteria, and people kind of ask you to, what rotations do you do before this one? Or are you in the beginning of your third year? Are you in the middle of your third year? If you're in the beginning of your third year, the expectations are less. If you're at the end of your third year, the expectations are more, okay? So when I'm saying like you should do your surgery clerkship near the end or your OB clerkship near the end if you want to go to OB, if you've done your surgery clerkship and then you go to your OB rotation and you don't know how to gown and glove or you don't know how to put in, you know, penned orders or you don't know how the EMR works, I mean, that's going to look bad, okay? So you have to be trying your best to some degree, trying to perform with every rotation. Because even if you don't care about that rotation, it's going to help you to grow as a med student, as a thinker. It's going to help you develop from reporter to interpreter to manager, okay? And so then by the time you're at the specialty clerkship of your choice, you're going to actually know things. Maybe you didn't feel like doing something for internal medicine, but now you're tasked with the same thing in your surgery clerkship. And if you had done that thing in internal medicine, you would have known exactly how it goes. It might be getting supplies. It might be consulting a specific service or paging somebody. It could be anything. I mean, it could be random. So this is just the reasoning that I did my clerkship the way it is. Again, I think that advice is put in the fillers, the stuff that is going to teach you, but it's not what you're after in the beginning. Put in the thing that you're seeking near to the end, and then try to get an easy rotation at the final end because that's when you're on VSLO, by the way, applying for a WAIS. That's when you want to wrap up in your research projects at the end of third year. So for me, I was on that psychs rotation, and I had all this free time to do stuff, and I did do a research project during that time. Also, you're preparing for step two, and you're coordinating your fourth year, so you want to have some downtime near the end because you want some respite, I think, before you hit fourth year. Because fourth year, those first 2 or 3 rotations in fourth year, before ERAS is out, you want to hit the floor running as well.